Let's talk about potassium, a vital mineral your body needs to function, but one that's often overlooked. You probably know it's in bananas, but potassium's real job is much bigger. It's an electrolyte, carrying electrical charges that keep your nerves, muscles, and especially your heart working properly. When potassium drops below the normal range, what doctors call hypokalemia, your body's electrical system gets thrown off. Potassium helps your muscles contract, your heart beats steadily, and your cells maintain the right balance of fluids. The sodium-potassium pump is always at work, keeping things stable and your blood pressure in check. If potassium falls too low, those electrical signals get scrambled, which can lead to serious health problems. That's why doctors take low potassium seriously. It's a sign that something's wrong and needs to be fixed before complications arise. Potassium is a behind-the-scenes powerhouse, and keeping it balanced is crucial for your health. Understanding its importance is the first step to protecting your body's electrical system. So, let's see what happens when potassium goes missing. So, how do we lose potassium? The most common ways are through the gut and kidneys. Severe vomiting or diarrhea can flush potassium out before your body can use it. Certain medications like diuretics can make your kidneys excrete too much potassium. Hormonal imbalances, such as too much aldosterone, can also cause your kidneys to waste potassium. Sometimes potassium isn't lost but shifts into your cells, like after a big insulin surge or with certain medications. Rarely, not eating enough potassium-rich foods can contribute, especially with restrictive diets or eating disorders. Usually, it's a mix of losing too much, not taking enough in, or potassium shifting to the wrong place. That's why hypokalemia often has more than one cause. Knowing where potassium goes helps doctors find and fix the problem. Next, let's look at how your body signals when potassium is running low. Low potassium can sneak up on you, but your body gives warning signs. Early symptoms include muscle weakness, fatigue, and cramps. Your muscles just can't work right. As levels drop further, you might get constipation or even paralysis in severe cases. The heart is especially sensitive. Low potassium can cause palpitations, irregular heartbeats, or dangerous arrhythmias. These heart symptoms are a medical emergency. Doctors use EKGs to spot low potassium. Classic clues include a U wave, flattened T wave, and ST segment depression. These changes help doctors act fast, sometimes before blood test results are back. Recognizing these signs is key to preventing serious complications. So, how do we fix low potassium safely? Treating hypokalemia means getting potassium back to a safe level. How depends on how low it is and your symptoms. Mild cases are usually treated with oral potassium supplements at home. If symptoms are severe or you can't take pills, doctors use IV potassium in the hospital, but it must be given slowly to avoid dangerous spikes. The real fix isn't just replacing potassium, it's finding out why it dropped in the first place. Doctors check for things like medications, kidney problems, or hormonal issues, and address them to prevent recurrence. Continuous monitoring is crucial. Blood potassium and heart rhythms are checked often during treatment. This careful approach keeps you safe while restoring your body's balance. But there's another key player in this process: magnesium. Let's see why it matters. Safe potassium replacement is all about going slow and steady. Oral supplements are best, but IV is used for emergencies, always under close monitoring. Here's a clinical pearl. You can't fix low potassium if magnesium is also low. Magnesium helps your kidneys hold on to potassium. Without it, your body just wastes what you're given. That's why doctors always check and correct magnesium levels alongside potassium. Sometimes IV magnesium is given first or together with potassium to make treatment work. Ignoring magnesium is a common reason potassium stays low despite treatment. The smartest approach is holistic. Replace potassium at the right pace, fix the underlying cause, and always check magnesium. This keeps your body's electrical system running smoothly and prevents dangerous complications. With careful, evidence-based steps, doctors can safely restore your potassium and your health.